Okay, thanks, Peter, for that very inspirational talk. You know, it kind of reminds me, my name's Glenn Block. I'm President and General Manager with Mertz Pharma in Canada. We incorporated in 2009, so we're relatively new on the pharma scene. But I've been involved in the pharma scene here for about 20 years, so some of you I've met and had the pleasure to work with. So it's great to be part of this conference, and thanks for the organizers to invite me. When Peter began to talk about the patient connection, you know, my mind immediately went back to a time where I organized as a sales representative for a previous company. I was associated with a product, botulinum toxin type A product, and I had the opportunity to set up a cerebral palsy workshop training in Calgary at the Alberta Children's Hospital. And I was able to coordinate a physician from San Diego to come up who had some sort of at that time, breaking frontiers in terms of treating patients with botulinum toxin in the cerebral palsy space. So I was sitting in the back of the whole event, so to speak, and I literally saw parents carrying their children in to the room to see if their child could benefit from this treatment. And I thought to myself, my gosh, if I don't do anything more in this business, I've at least made this connection and created an opportunity for some patients and cerebral palsy patients to benefit from toxin therapy. So thanks for reminding me about why I get up in the morning and why I'm proud to be part of this business. So, okay, so my task, and I chose more of an academic approach to the product of the 4 Ps. I was educated in marketing and business, so my mind automatically went to the university course I took back in way back when in Queen's University, and reading about the marketing gurus like Philip Kotler, etc. So I'm just going to go at a really high altitude, but going to focus in on a few main points that I think are some key takeaways in this area. So I'm going to talk about the Ps product being the epicenter of the Ps that we're going to be talking about. How do companies decide what to sell? It's very interesting, you know, the rationale there. Where do they come from? So, you know, an interesting debate might be, are blockbusters born or are they made? It's, you know, you can kind of have an interesting discussion around that, and it's probably a little bit of both. How to maximize a product's value, and then finally creating and managing a portfolio. And Peter mentioned a little bit about that and how integrations work and how do you maximize that. Okay, so question 1. If in your organization you would rate your company's current product portfolio, would it be 1, you're facing serious challenges, whether it be generics, et cetera, in the near to medium term and need additional products? Or 2, you have a reasonable portfolio, but it'd be always great to add a few to the bag. Or 3, you're Lauren Markowitz at Valiant and you have an excellent portfolio and more than enough products to sell and launch. So we'll take a few minutes. Okay, good cross-section there. So, wow, there's more on the category 3 than I would have suspected. But most of us are in the middle, and I would agree with that. Okay. All right, so if we just take a real high-level sort of textbook look at the Ps, you know, in marketing, a product is anything that can be offered to a market that might satisfy a want or a need. So that in general is the definition. But in pharma, we find ourselves sometimes being offered a product by R&D, sort of saying, here you go, try and create a want or need with this. We discovered this and it has some effectiveness here and there. So these are kind of things that can happen to us, but bottom line is we all need something to sell. I mean, this is why the P is our product is the epicenter of the piece. Now, in terms of deciding what to sell, you know, there's always something that already exists. We can try and grab market share in that regard. You can make something that someone asks for, so meeting unmet needs, as Peter said. Anticipating something that someone will ask for. Or finally, making something that no one asked for, but that will give buyers great delight. And that's something that Apple was really great at, and Steve Jobs, in terms of making something that I don't think anybody asked for an iPad, but all my kids do now, and many of us have one. So that's an interesting way to go about doing business. So in terms of how do pharma companies decide what to sell, I think, you know, of course you can do the classical business case and look at disease prevalence and treatment rate. There's obvious issues around these days with IP situations. Is it patented, and what is the patent protection there, and these kinds of things. And these are the business-related issues. And the one aha for me on the IP situation is most people think about patents with regards to molecules and manufacturing processes, but you can also patent use patents with particular products. And so this is an area that is also a way that you can either protect yourself and use that as a way to hold your market. Of course, we're going to be talking later about price, and that comes in with the PMPRB. And then finally, reimbursement and getting access, market access, is always key. So that all feeds into, you know, are we able to make a reasonable profit? And that speaks to Robin's introduction about how that balance happens between profit-motivated versus patient-centric. So in terms of where do products come from, I think, you know, we'd all agree there's the traditional organic R&D. You've got the white coats guys running around, you know, doing a lot of, you know, inventing and those kinds of things, whatever they do, and then, you know, coming out with a product. But one of the key things is, and I'll speak a little bit more about this later, is that ideally the R&D process is commercially and marketing driven. So you're looking at an unmet need, you're feeding that into the R&D and moving the product through. I mean, it's traditionally very slow, and of course we know the success rate is not great. And of course we all hear about stories of around accidental sort of discoveries during the R&D process that you get a different, we'll call it an adverse event, but it's a positive adverse event that you hadn't originally sought in your original trial. So you intend to go after this indication or this use, and certainly some other areas of effectiveness come to the fore. Because things are so expensive, certainly co-development programs share the risk and cost of the developments with the partners, so there's that option. And then, of course, the acquisitions and in-licensing, which is, I say the Valiant philosophy. There's some interesting news recently this week. Mertz looked at an organization, Valiant countered with an offer, and so on and so forth, and it looks like Valiant's going to get that one too. So, you know, it's one of those situations where if that's your strategy, obviously you're going to be looking for synergies with the existing infrastructure. And the reality is that many companies are competing for scarce products out there. And in order for this kind of strategy to move forward, you really need a strong leader who buys into that philosophy and drives that. So one more question here. So vote in your company, which is the dominant sector in your organization from where you see your products coming from? So one, is it dominated by organic growth, which is the internal R&D, that traditional side? Or two, co-development programs, which again is organic, or is it three, acquisitions? Probably it's a combination of both, but if you vote for your dominant one, then that'll give us a little bit of an insight here. So let you vote there. So acquisition in licensing, and the second one was co-development. So interesting. So we're all in the acquisition, or a lot of us are in the acquisition mode, and I would agree with that. So let's move on to the next slide. All right, so you've got a product. You know, the challenge is, how do you maximize the value of that product? So one of the ways, again, where you're looking at, obviously you've got the molecule attributes and what it does for patients, but you know, part of adding the greater product value or greater product offering is not just selling a product, but selling an experience. And so in pharma, we want to create a greater product offering. And the key, which is in line with what we're talking about, is always try and be centered on the patient. So, of course, you know, these types of retention programs, nurse service, patient education, physician training, I mean, these are the you know, huge part of, I think, what Peter's group does as well. You know, these are kind of the ways that can add value to the product and facilitate use thereof. All right, so if there's one thing that I'm adamant about, and coming from a company or working for a company that's 100 years old, that is steeped in traditional R&D development, one of the challenges, and we're getting there, is that having commercial and marketing input at the earliest stages with R&D. And this is hugely important. You know, again, I stated this before, ideally the marketing group or the commercial side of the business drives the R&D development. And, you know, you really have to impress upon those folks the importance of the clinical trial design and the endpoints and how that relates to the commercial value of the product. In working together with a strong regulatory person to get the broadest and most commercially friendly label in a timely way. So it's always a balance between wanting to get a product approved very quickly, but spending some time and energy going after Health Canada with a little back and forth with regards to the commercial friendly wording is going to be payoff in a big way when you get to driving your messaging in the downstream. Here's one also where you've got an existing product, and you know, physicians are out there kind of using it in the indicated areas, but also sort of doing some experimenting with it in some of the other patients where they feel that they could benefit. And the key here is to really listen to the physicians in how they're using this product. You know, again, obviously, you need to be close to your patients and your physicians, but clearly this can broaden the label and the usage significantly. Usually starts with these IITs or investigator-initiated trials, but it does require a solid medical team and a medical team that gets that connection between this interesting use and the commercial viability. And finally, you know, in terms of optimizing your portfolio, so, you know, some of the companies that do have such a broad range of portfolio, you know, how do you optimize this? And you really have to organize your organization in a way to make sure that you know, there's focus. And so, again, I think it's an interesting example about Sanofi and Genzyme and how Genzyme's running as a Sanofi company type thing. You know, this is allowing that company to operate in the way that they need to address the needs of their patients and the physicians. And so oftentimes what happens is you've got a plethora or a wide-ranging a portfolio of products, and some of these are underdeveloped or receive inadequate support simply because there might be a lack of resources or knowledge, or other products are getting more attention because they're making more money, and deservedly so. They need to be resourced appropriately. So the advice here is that you should decide on what core pharma market spaces you want to compete in and dominate and play in, and carve off those assets that are outside of this. And if carve off means just let them run on their own, that's fine, or just you know, cut them loose, because it's going to be a drag on your organization. And that's a quick overview of what I had in mind to talk about, so I thank you for your attention.